your kid all the time, and how many, if you take a kid to the grocery store and they see all their favorite characters in the cereal aisle, it's very hard. You don't want them to have a temper tantrum in the middle of the cereal aisle. And the other thing I was going to say is about default choice, about not only are there policies that affect, but just the way things are laid out. Set food up in a grocery store, or a way the school cafeteria arranges the food in the cafeteria line for elementary schools, that can have an effect on what children eat. And so I think that's something I learned from reading this really interesting book by Cass Sunstein called Nudge. These are things I think people could think about and be more thoughtful about the way they're done. The grocery store layout is obviously done to maximize the sale of the products, and they know that to take advantage of the nag factor.
I don't know the answer to most of your specific questions, but they are the right questions. And the larger message that your questions, your comment points to, is that there are vast areas of public policy that are made often in response to different interest group players that certainly don't have health on their minds. And to the extent that these questions, whether they're questions of what we might do to address urban or rural poverty, or how we should structure the agricultural subsidies that the big companies like the ConAgras and all over the world, legendarily lobby for. To the extent that there are questions that beyond health are articulating the issues in health terms, ideally with evidence, scientific evidence that points to the relationships between these policy choices and health outcomes, can be immensely powerful. Take social and economic determinants of health, which I happen to believe is at the root of a lot of this. If we do something about urban poverty and the urban underclass phenomenon, I think a lot of these things take care of themselves. Americans are not bothered by the fact that some people drive Beamers and other people drive beat-up Chevys. The fact that Mr. McCain got some traction with his Joe the Plumber campaign underscores this. But American health inequities. Health is a kind of, as the economists put it, a merit want or a merit good. A good that people tend to see as they tend to think should not be distributed in accordance with the existing distribution of wealth. So to the extent that it can be articulated that a whole bunch of policy that defer to the existing distribution of wealth and power are in fact hugely important to health, and of course here we are not wanting health to depend on wealth and power, that has tremendous advocacy potential.
I was wondering if you might talk about the public perception and also the effect of the legislations that were passed in New York and California. Have you done enough monitoring to know by now if it's had any positive impacts, and what did the residents think?
Well, California has just gone into law, so I don't. It was supported enough to get passed. That's the only point we have on that. New York, I believe, just went into effect last summer, is my recollection.
Yeah, they did have that American Journal of Public Health article.
So I think it's too early to have any data to know.
There was some data that showed. I think.
Well, there have been some studies on
the effect of menus on.
Right, but I believe it was July of this year that the New York City one went into effect. So I don't think we yet know.
I guess the general basis of my question is, as I try to think about sort of what's going on, and I think of what's going on in Scandinavia, for example, where they're sort of much more progressive about these things, and I think of sort of how can we implement federal legislation that sort of have much more teeth to them and sort of more consequences and so forth. I'm wondering, what is the likelihood of that sort of legislation having public support? Just sort of, would the normal sort of Americans sort of want? Are they aware enough of this issue to want their congressman or woman to sort of be doing more on this?
Well, one is I come at this actually from a local government point of view, and so I'm somewhat less sanguine about either the likelihood or necessarily the desirability of federal legislation as the solution to all this. If we could pass a law about it, we could make it all go away. because from the kinds of issues that I'm worried about, these are, they may or may not be legislative. They are people on the ground. They're school officials deciding where to locate schools. Okay, that's not federal legislation, and it's not people setting out to do evil things. It's people with multiple agendas for whom health is probably not on the screen of the questions that they're asking themselves. So, I mean, there may be areas in which federal legislation is a good thing. I'm not opposed to it, but I think in a lot of these areas, the issues are not necessarily likely to be solved by a federal mandate to sort of somehow fix them.
I'm interested in the government's role in this field of regulating obesity, because it seems to me that there is some paternalistic element in regulating people's behavior, and also there's a danger of intruding on people's liberty of choice. And I understand that there is every reason to justify innovation. One would be that, as you just presented, if the behavior of people are mostly developed through the children's when they were children, it would make sense to try to change their behavior while they're a child. And also, another argument that justifies innovation would be that the healthcare system of a country is supported by the public in general. So even if the people with obesity are not, in order to support people with obesity, every people will be involved. So that makes some argument for intervening the regulation of obesity. But on the other hand, I feel that it's at the end it's people's choice. And you just mentioned Professor Cass Sunstein's nudge, and I have a scheme of that, and I agreed basically that he's arguing that it would be better if the government doesn't force people to behave in a way, but to change the default is what he argues. And I'm not sure if I made myself fully understood that, but what I'm interested in is that to what extent should the government involve itself in this field of regulation?
Well, one observation I would make is that at least in the areas that I'm involved in, like it or not, the government's already making choices. So the government is building the roads or not building them. They are building the sidewalks or not building them. They are locating parks. They are locating schools. They are prohibiting fast food restaurants or not. Land use is massively government regulated. It's just an unbelievably complex web of government intervention. So government's already intervened. The question is, what will be the nature of that intervention? And at the sort of the most crude level, will they build sidewalks with telephone poles in the middle of them or not? Government has chosen to build them that way. Should they? It doesn't strike me as paternalistic to say it's just government when you put a telephone pole in the middle of the sidewalk, but it's paternalistic if you take the telephone pole away. Both were government action for reasons. They didn't. Again, it wasn't someone being malicious putting a telephone pole there. They were making trade-offs about costs. But if you're making the decision anyway, one thing to take into account is what will the health impact be.
Well, Wendy, is it trade-offs or is it often a coordination problem? I venture to say that the sidewalk and the telephone pole, that was a marvelous picture. I want to get that picture. But I would speculate that you have two different agencies. One, the telephone pole sidewalk authority, and they're both and you get that picture.
Sometimes, although I think in that case, actually, that was the result of a decision to widen the road. And you decide to widen the road and basically eliminate the sidewalk. Those choices are made all the time.
So the pole was there before the road was widened. Then the road is widened and the sidewalk gets put around the pole.
Right. I think that in that particular case, that's, but sometimes it's a coordination issue as well.
But that underscores another problem. Inevitably, as different policy initiatives are layered on top of each other over time, there's going to be these contradictions. And the only way you can avoid these contradictions is to basically make a new capital investment, in this case, to move not just the pole, but you have to move a whole bunch of the other poles, change the lines and all. So there will inevitably be a lot of those contradictions as a complicated system tries to accomplish a bunch of different
Right,
things.
and in any particular case, it may not be worth the $10 million it would take to move the poles. I mean, you want to spend $10 million on
Suppose
that.
you can't move that pole without moving a whole bunch of other poles,
And
changing the lines.
so you're making a choice, and in a particular case, it may not be worth it. Question is to what extent will you take health into account as one of the factors, as opposed to it's only being about how much will it cost and how many cars can I get to this intersection.
Can I add on? I want to highlight your point that I think the children's eating habits and their tastes, what they like, what they don't like, and food has a whole lot of psychological aspects as well, what's comforting and so forth. Those patterns are established for children, and to the extent that some of these things may be considered paternalistic, I think that's okay for children. I mean, we are paternalistic for children. We don't let children do whatever they want, whenever they want. They're not adults. They don't have the capacity and the reasoning to make choices necessarily that are in their best interest. That's why we have parents, but as I've explained, parents can't do everything. And in particular here on eating, because what you choose to eat is so influenced by the advertising. It's a short term, I want this cookie, versus the health consequence of that cookie, eating that additional cookie, may not really, appear till you're 50 years old or something. So, I mean, it's just not really possible for children to make those kinds of irrational trade-offs. And in fact, young children don't even understand that advertising is advertising, or the purpose of advertising is to try to sell you something. So that's why I think there is some paternalism, but I think at least when you're talking about children, I think it's, justified.
Angela, can I just press you on that briefly? What about things like, the so-called VAT tax, the idea of having a tax on certain kinds of products? What about proposals like that Governor Schwarzenegger included in his health plan in early 2007, the possibility of incentives and penalties built into your health insurance premiums, depending on whether you use the gym? All these things for adults. Some, in the eyes of some, paternalistic and intrusive; in the eyes of others, remarkably attractive as a way to motivate people.
I think when you get to adults, it's a much harder issue. I mean, adults are not immune to advertising either, but we at least assume that adults have a somewhat better capability to make rational decisions. But decisions are influenced by advertising and by a lot of unconscious factors. I mean, so I don't really have a position on the question that you asked. I think it is a tough question, and it raises again some of these sort of cost-benefit analyses, and just in a different way, I think.
More students, Michelle.
You talked a lot about the companies advertising to people, but also the entertainment industry seems like it's not completely innocent. And so I was just wondering what kind of regulations or pressure is being put on the entertainment industry.
Well, some of the companies have some of the main children's media companies, of course, are Disney, Nickelodeon, and Cartoon Network, which is part of Turner, AOL, Time Warner, Turner. I don't know. It's hard to keep track, but and so they have. Some of them have made pledges, some of them haven't. They mostly have to do with the use of their licensed characters and what kind of products they can be associated with. As I mentioned, it's a huge business, but there is no organization that is really focused on that or monitoring that. And there was this obesity task force that was set up by with some members of Congress and some members of the FTC and some members of, FCC, industry and advocacy groups. And this was one, they never issued a report because they were unable to agree on any recommendations. And that was one of the major sticking points for them.
I was wondering, the debate around obesity and weight disease is obviously been growing in the last few years. So I wondering if you see any change in sort of government policy to take that into consideration when legislating or publishing policies with things that don't directly impact, or at least not intuitively impact that kind of that area. I'm sort of thinking of sort of minimum wage, okay? So people who make minimum wage can't afford the fruits and vegetables at the Giants. And so one way is to handle the subsidies of that. The other way is to, raise minimum wage. How much do you see that taken into effect? Sort of things like that, minimum wage, working hours. People who work 12 hours a day can't cook when they come home. I was just wondering, do you think it's realistic to expect that to be taken into account?
Well, I'm not sure I understand your question. The point that Greg has made is that there's every reason to believe that health is closely correlated with economic conditions, and so if those conditions get better, health will get better. But
I think that's, the question is how much when sort of making policy decisions around economic status is health taken into account?
Probably not very much, would be my guess. But I'm not sure. As reasonable people differ on whether raising the minimum wage improves overall economic status for the population as a whole. So, it would be hard to tease out whether the opponents of minimum wage were people who just wanted more people to be sick and die, or they thought that the way to achieve a better economic outcome is without minimum wage.
I think the broader point here is rather than getting sort of riled over, well, we raise the minimum wage, but we make it harder for businesses to start great jobs, and there'll be more people unemployed. There's that sort of back and forth. We could do that, but that ends up being a distraction from a larger urban development and economic development agenda, and where health can play a role is as a rhetorical tool, because, and this is what I was getting at before, Americans tend to be much less tolerant of disparities in health than they are in disparities in ability to buy a Beamer versus a beat-up Chevy. So, one person shopping at the Whole Foods and another person, buying the Spam, right? People aren't bothered by that until they, it's, oh my God, if you buy the stuff at the Whole Foods, you might actually do better for a longer time than if you eat Spam.
Okay, I've got three. Oh, I've got more than three. I'm going to just take the first three that I saw. I'm going to have them each ask a question, and then I'm going to have the panel reflect. We've only got a couple of more minutes. So 1, 2, 3.
That's me, right? Okay. My colleague brought up WIC, which I think is a wonderful program that targets low-income communities and kind of forces you to make nutritional. You can't get WIC coupons until you have a nutritional consultation. They limit the scope of your purchases. You can't buy frosted flakes. You can only buy Kellogg's. You can't buy sweetened juices. You can only buy natural juices. And it's such a great program. And you also get the coupons to go to your local farmers market. Have there any, and I know they're targeted towards nursing mothers or women with small children, has there been any push to expand that program? Or any studies on the impact of the program?
They're not going to answer?
Yeah.
Okay.
I was wondering if, with respect to the topic of how it influences children in ways that you improve upon them with different regulations or voluntary agreements. What about with respect to adults? I understand the paternalism thing, but are there any types of discussions taking place to sort of affect that?
Okay, that's the last word.
I wanted to say that one of the things that's striking about this discussion, especially in comparison to some of the previous colloquium discussions, is that we seem to be moving beyond the areas in which health advocates and health lawyers sort of are seen as having a legitimate role and having core expertise. And so I wonder, we're doing important work to identify these relationships and the role that law is playing and its impact on health in these areas. But I'm wondering what's the next step in terms of highlighting that impact and taking it into account, particularly in light of the fact that much of this is going on at the local level, where it's more difficult in some ways for what is really a small group of health law scholars to have a voice.
Okay, well, those are three excellent questions. Why don't I ask each member of the panel to sum up in 60 seconds each? 90. And then we can all have cookies.
And walk around the block.
You have a preferred sequence?
Professor John.
I'm going to address your question, even though you asked it last. I think that what legal scholars have to offer in dealing with these problems, and clearly a lot of the expertise, the research expertise on these issues is not provided by legal scholars. What legal scholars have to offer is two things. Number one, an ability to synthesize information from a broad range of sources and frame arguments with an advocacy perspective. Arguments aimed not just at courts, probably mostly not at courts, but at the broader public, at legislators, at other policy players, and at stakeholders who might be leveraged into supporting positions that they at first might not be tempted to support. That's number one. Number two, lawyering at its best is about institutional design for the management not just of conflict but of opportunity. And the management here of enormous challenges of coordination. I love the phone poll in the sidewalk because to me it conveys, and I think Wendy really got to this, made this point really nicely, it conveys, it's a story about a whole series of governance problems. It's a story about coordination. It's a story about institutions not weighing health sufficiently. It's a story about the layering of policies upon each other over time. And what legal scholars have to offer is hopefully wise thinking about how one structures governance institutions in order to address these problems.
Just very briefly, on the last question as well, I think what health professionals can do and what lawyers can do is to make sure you're asking the right questions. You may not have the answers, but you're asking them, and on the institutional design, figure out to whom to ask them and in what context. Figuring out how the system works and making sure the questions get asked. WIC, I don't know the answer. Something. That's a short answer. And advertising to adults.
That's the right question.
Yeah, I mean,
it's a very good question.
With respect to advertising to adults, one thing I'd say is, to some extent, what we see, I think, in New York and California is advertising to adults with more information. So instead of the regulatory mode of don't say it, which is what's been targeted at children, stop talking this way to children, it's providing more information. Now, I think that the data on nutrition labeling is not all that compelling as the little packages, and we'll have to see whether more information nutrition point of sale restaurant, does that have an effect? I think we don't know. So sometimes an answer to adults is more information, and that of course responds to a paternalism concern. It's not paternalistic to tell people more.
Yeah, I think that some of the kinds of things they're doing with children's products are being done with adult products. And in fact, one thing I forgot to mention is that there, just actually a couple weeks ago, there was announced a new initiative to come up with a standardized symbol or icon that could be used on foods meeting certain standards across the board to just sort of unify it, like the seal of good housekeeping or whatever. And that probably could be something that would be used in advertising to adults. But as far as the attempts to regulate or restrict, I've not really heard of any attempts in terms of adults. Teens is where the battle is, because the current programs are only applicable to under 12s. So that 12 to 17 is it's an age where teens they have a lot of spending money. They can spend themselves, and so marketers are very anxious to reach that demographic. So that's where I think the battle's going to be fought.
Okay, well, thank you very much to adjourn to some conversation
I'm happy to
not well.
What I wanted to share they are a strange organization. They might not really so what I was going to propose with them is not that, maybe independent research. Just to bring back semester, fact sheet about the issue, or that. And the independent it is. It needs something. Thought it's a perfect good idea, and work that you would oversee the
Yeah, I'm sure.
Some of the questions were very straightforward to what I know about employment law and about Fair Labor Standard Act, just about a whole host of vicarious life. They don't sound, and I could be naive, but they don't sound.
Is there a way that if I quote it
Oh, like the outlet, it's a little complex. I actually think they're clearly not self-evident, or someone who's the answer. They're not self-evident. And what occurred to me during the kind of exchange about it is that these are situations that are situations that have already gone on in American law, with other populations, and all sorts of analogies there. Where you can begin a research tech is American law often is created on analogy, based on analogy analysis. So not what does that mean? You don't need to have a good church talk. But also, right. Going to the U.S. agreement. And what I they're trying to build monitoring mechanisms for clients. Is actually getting
Right. And so I think
The other person
like create a fact sheet a good idea because they could actually be the kind of fact sheet putting their information right. So they could actually get out there to unions, nurses associations, nurses hospital groups, hospitals. Right, so I actually think like some way that you can, might be able to leave that into your email, maybe as part of an information campaign about the code.
Well, I said something along the lines of I know that Academy has a source of information for people, and so maybe the end product would be fact sheets about the law that you could push out to your members or through your initiative or something like that.
Because the main thing now is code. We was going to do anything because we want a legal code. It's a software code. Right. So if we want to do anything, a big part of getting information out about the code, but also about the provisions. So I actually think it's very timely to be thinking about fact sheets.
I know it helps with stakeholders to know straight up if they're breaking the law.
Exactly.
And if they just haven't been caught at it yet, even if it wasn't intentional.
No, they just don't know how to do the right things, what they're doing is wrong.
Right.
So I think it's a very radical project. And I think, she was pretty clear about where the gaps are. So they were research questions.
So I think what I'll say at the bottom is if a mentorship is impossible, then perhaps I can meet with her. Take down in a little more detail what she feels the gaps are, and then do an independent research study here with you and Boston.
That would produce a product.
That would produce a product that they could use. Okay,
so that's good. That's very good. I like it.
Good. All right, so I'll send you, I'll keep you posted.
That's okay.
Yeah. It's just this one.